focus this evening, new guidelines on when patients with COVID can be released from hospital. Now, these are the guidelines. Let's go through them. If you have, or if a patient has very mild or pre-symptomatic cases, these can be discharged after 10 days of the symptoms presenting themselves, and no fever for a period of 3 days. No test is required before discharge from COVID care centers. For moderate cases, if there's a fever which resolves itself within 3 days and there's no need for oxygen, these individuals can be discharged after 10 days of symptoms coming on and making themselves present. No test required before the discharge from dedicated COVID health centers. For moderate cases, if symptoms are not resolved in 3 days and there is a need for oxygen, they can be discharged only after resolution of clinical summons and the ability to maintain oxygen saturation for 3 consecutive days. Again, no tests are required before discharge. For severe cases, they can be discharged only after clinical recovery and the patients test negative once by RT-PCR. Well, joining us now on these revised rules is Dr. Rajesh Malhotra. He's the chief of the COVID facility at the Trauma Center of the All India Institute of Medical Sciences. Thanks, sir, for being with us. Also, Professor Arvind Kumar, chairman of the Center for Chest Surgery and Lung Transplantation at Sir Gangaram Hospital. Thank you both. Dr. Malhotra, why the new norms which say that in many cases there doesn't need to be another COVID test before a patient is allowed to leave?
Now, there can be several explanations for this. One is that once the clinical resolution of symptoms occur and the fever comes down, the viral load in the body becomes quite low. So, how much theoretically a person is infective at that stage is the question. On the other hand, the healthcare facilities will get burdened with the patients who really don't need to be in the hospital. See, those patients who are stable need to be in hospital only for the containment. They were being kept there so that they do not spread the infection in the society. Now, once a time comes when you have more people who need the oxygen or the ventilators, I think it's a pragmatic step to now let go of patients who have recovered from the symptoms, and the possibility of their being infective becomes a little low. So I think it will ease off the beds for the patients who need oxygen or the ventilator, and that is, I think, the real purpose behind this.
Yeah, that makes sense. Dr. Kumar, isn't this really that scenario now which we discussed more than a month back, where the numbers might prove to be progressively overwhelming, right? So now we are telling people, if you're not too bad, go home, no COVID test, give the beds to people who are worse and more ill. Today, we have crossed 60,000 cases in this country. Yes, the recovery rate is good. Yes, the death rate is low, but the absolute number of patients is more than 60,000. And now we've got these rules. So isn't this really, a pretty bad scenario to be in?
Yeah, I agree, Vishnu. When we had that discussion on 19th of March and I made that statement, I actually was hoping, although that reality was staring in my eyes, but still I was hoping that something will get done and we will avoid such a situation. A drastic step was done, was implemented, but despite that, although we've been able to defer the cases by at least 6 weeks, but definitely last 1 week has been very disappointing, because although percentage-wise the case, the positivity rate is same, as you said, the improvement rate is good, death rates are low. The fact is that the numbers are spiraling like anything, and these are going to now test our health facilities to the ultimate. So continuing to what Professor Malhotra very elegantly described, I would just add that these changes have occurred because of 2 reasons. One, there is a report which came from Center for Disease Control in US, where actually looked at the viral and replicable or replication competent viral tissue present in the patients who had recovered. So they noticed that after 10th day from the onset of symptoms, even if you are detecting a few viral strands in the RT-PCR test, as far as a replicating competent virus is concerned, they are not able to grow this virus, which they interpreted as inability of this virus to be able to infect other people, thereby suggesting that probably from now on, if you discharge these patients, the chances of second transmission are extremely low. So this they have reported after extensive testing, and this was one basis. Two, as Dr. Malhotra elegantly said, that now that the cases are spiraling, those 4 to 5 days of free patient stay left that we will get will also be a big number of more beds being available to take care of more patients. So
okay, Dr. Kumar, one moment. I just want to rotate the strike. I want to go back to Dr. Malhotra, because I'm running short on time. Dr. Malhotra, initially we saw the Markaz episode over here in Delhi when in a small amount of space, a lot of people were infected. Later on, we saw in a small amount of space with CISF Jawans, a large number of people were infected. There were super spreaders who suddenly emerged. Now you've got this unseemly situation in Delhi and in other parts of the country where people are lining up for alcohol. There is zero social distancing. Is this not a worst case scenario for us, where now going forward, because people aren't stopping the sale of alcohol across states, now going forward within the next 2-3 days, there is a possibility that you'll see a huge explosion in cases? And these are people who've gone home. Who's going to trace them?
So that's a very pertinent point. Nobody can argue with that. See, the rules of the game remain the same. The social distances is relevant today. It was relevant earlier. It will remain relevant as long as the virus is hanging around. And we have repeatedly said that its basic problems of overcrowding, sanitation and hygiene are the harbingers of these kinds of spreads. And wherever you see we had these clusters where there was overcrowding, and there is no way one can defend, the overcrowding, whether it is for the alcohol or for any other reason for that matter.
Yep.
So it is definitely a cause of concern, and like you said, you can't trace the contact, and if you don't, you are not able to trace the contact, you say this is a person who got infected, and because we can't trace the contact, possibly, we have it is much more sinister and much more in the community than we think. So all these will have epidemiological repercussions also if you don't know where the person is getting infection from, because those in the queue will just disappear in different directions. So that is a concern. I totally agree.
Dr. Kumar, one final question to you. Projecting forward at this rate of doubling of the infection, the recovery rate, the relatively low death rate, and yet the absolute numbers are large, right? When do you project? Is it possible to project when we will flatten the curve? The WHO seemed to suggest that it would be some stage in July when we would start winning. Is that your expectation as well?
Vishnu, if we look at countries which have been able to cross over the peak and flatten, it's not actually flattening the curve was for lockdown. Now we have to actually cross over the curve and come to the downward trend. Thereby we start reducing the cases. So Europe, Italy, France, Spain, these are the countries which are now coming. Their number of cases per day and number of deaths is now coming down. And if we look at the period, it was around somewhere around 10th of March that they had that sudden spike. So it's about 2 months that this virus has played havoc there. And this virus has started playing similar havoc in our country about a week or 10 days back. Mm-hmm. So I think we are looking at 2 terrible months ahead of us in our country.
2 terrible months. Let's hope that that's not the case. We'd all
let's pray
that that's not the situation.
Turn out not to be true.
But who knows what's going to happen? This is all very frightening.
Yes.
I'd like to thank both of you, as always, for joining us and sharing your views on all of this. Thank you both very much indeed.